National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Naturopathic Doctor Jonathan Beatty, health expert here at nationalnutrition.ca. One of the common causes of heartburn that I see in my practice that many people don't even realize they have is something called a hiatal hernia. What a hiatal hernia is actually when a small portion of your stomach protrudes up through your diaphragm into your thoracic cavity. Why this is a problem is at the top of the diaphragm you have a little valve that helps close off the stomach. And what ends up happening is if the stomach protrudes above this valve, when it squeezes to close off the stomach, it doesn't actually close it off entirely, and what can happen is the stomach acid produced in the part of the stomach that's pinched above this valve can now regurgitate up into your esophagus and create heartburn-like symptoms. So this is why often people with a hiatal hernia will experience chronic heartburn that can be very difficult to manage even with medications. So oftentimes if you have a hiatal hernia, you'll often have this very persistent heartburn that's difficult to treat. And the reason is because it's a mechanically induced heartburn. So there are some mechanical therapies like massage therapy, chiropractic, or osteopathy that may help manage a hiatal hernia. In severe cases, some people will require surgery to have it corrected. But if you have the symptoms, there are some things you can do to help mitigate those symptoms to make you more comfortable while you decide on the correct course of treatment for your hernia. So some of the things I often recommend to my patients is to take in aloe vera juice or aloe vera gel. The main reason you're going to want to take aloe vera is just the same reason you would put it on a burn on your hand, is the aloe vera is actually going to help heal from the burning that's created by the stomach acid. So it can be very effective. Another thing I often like to use similar to aloe vera is slippery elm. The inner bark of the slippery elm tree, when ground into a powder, can be taken and it creates what we call a mucilage effect, where it basically, kind of like nature's stomach aid, what it does is it coats and soothes the irritated portion of the stomach. And so again, this helps to reduce that inflammation that creates a lot of your symptoms. Other things that you can look at taking, well, sometimes with hiatal hernias, because of this chronic inflammation, you can actually develop an infection called H. pylori, and you can supplement with something called Mastic Gum, which can help heal any type of ulceration and help reduce the chances of you developing H. pylori. And then with that, you could also look at something called Deglycerized Licorice. Licorice, the herb, contains a chemical that can raise blood pressure. So taking large amounts of licorice could potentially give you high blood pressure. So for this reason, when we have to use high amounts of licorice, what we take is something that has had that compound in licorice removed, and that compound can cause the high blood pressure. So it's glycyrrhizinic acid, so what we call it is deglycerized licorice. This compound won't raise your blood pressure and will provide the soothing benefits of licorice to your digestive system, reducing the irritation to the stomach and the esophagus, reducing ulceration, and reducing your risk of getting an H. pylori infection. One of the reasons that some people, when they have a hiatal hernia, even if they get it corrected, they could sometimes get it again, and that's because of loss of elasticity of the connective tissue in the stomach. And there seems to be an association between people who overeat at meals, and what that seems to do is stretch out the stomach too much. It becomes a little lax, allowing it to protrude up into the thoracic cavity. So by eating eating more smaller meals, what you end up doing is preventing that excessive stretch, maintaining the elasticity of the stomach, and that prevents it from stretching and migrating up into the thoracic cavity. So that might be a great prevention strategy if you are either prone to hiatal hernia because of a family history or if you've had one before. So if you have a hiatal hernia, I hope the tips I've taught you today will help you to manage your symptoms while you decide on your treatment plan. If you like this video, please check out more of our videos, subscribe to our channel. As always, you can post any of your questions or comments you may have below. We love to hear from you, and always remember, knowledge is health.